go ahead and turn your head as far as you can this direction, and I'm going to apply that same downward pressure. Good. And turning the other way as far as you can. Good. Okay, I'm going to put a little bit of pressure down on your head. You're to tell me if any of this bothers you, if it brings on your pain or any of the symptoms that you're complaining of. Okay, here we go. Okay, I'm going to tilt your head a little bit this way. Same thing. Good. And this way. Same thing. Okay. Now we're going to lean your ear towards your right shoulder, turn, and a little bit back. Good. And hold. Good. Left ear to left shoulder, turn, and a little bit back. Good. Okay. I'm going to now apply a little bit of a pressure upwards and put my hand on your chin and a little bit at the base of the head, and we're going to apply a little bit of an upward pressure. Good. So for this test, I'm going to start by pushing down on your shoulder. Okay. We're going to move your arm into some positions again. You're going to let me know if you have any pain or if we reproduce any of that numbness and tingling down your arm. Okay, here we go. Okay, and now lean your right ear to your right shoulder. Okay, good. For this test, I'm going to move your arm into a sequence of positions, and you're just going to let me know if any of the positions cause you any pain or discomfort, okay? First thing is going to be a push down onto your shoulder. Okay. And can you tilt your head away? And hold. Good. Okay, we'll come back to the middle and do the same thing again, starting with that shoulder down position. Okay, tilt your head away, and now I'm going to straighten your elbow. Okay, good. Back to the middle. For this test, I'm going to do the same thing. I'm going to push down onto your shoulder to start with. I'm going to take your arm into some different positions. You let me know if you have any pain or tingling down into your arm. And now lean your right ear to your right shoulder. Okay, good. So for this test, we're going to take your arm into some of those positions again. Again, you're to let me know if you have any pain or if you start to have that numbness and tingling. Okay, so I'm going to pull down on your shoulder again. Take it. Okay, and now tilt your right ear to your right shoulder. Okay, good. So for this test, I'd like you to take your left arm, place it on top of your head, so it's resting like that, and just let me know if that changes any of the pain or discomfort you're having. Okay, good. And relax. For this test, the examiner takes the patient's head into the position in which the treatment is going to take place, commonly flexion and side flexion, or extension and side flexion combined with rotation. Once the position is achieved, at the end of the range, the patient's head is held in position for approximately 30 seconds, or until symptoms are provoked. Both sides would be tested, starting with the non-symptomatic side. The test should be done with care as it can affect the blood supply to the brain. I'm going to just get you to bend your head forward a little bit and then just relax in that position. Okay, good. Back to the middle. I'm just going to tilt your head a little bit forward and then just try and relax. Okay, good. So for this test, you're going to feel a little bit of a squeeze on your upper part of your neck, okay? And we're going to do the other way. And relax. So I'm going to apply a little bit of pressure on the upper part of your top part of your neck, okay? And then I'm just going to apply a little bit of a sideways bend. Okay? And relax. Okay, for this one, I just want you to try and relax your head. Okay, and I'm just going to do a little bit of movement here. Okay, good. For this test, the patient lies supine so that the forehead and chin are parallel or horizontal to the bed, placing the craniocervical and cervical spine in the neutral position. The head may be supported on a folded towel. The pressure sensor is positioned behind the neck and below the occiput. The bladder is inflated just enough to fill the space between the bed and the neck with no pressure felt on the patient's neck. The patient is then asked to slowly nod the chin towards the sternum and to maintain the end range for 10 seconds. To test endurance, the test may be repeated 10 times. For this test, I'm going to apply a little bit of a pressure down on the left upper shoulder and then followed by the right. And you let me know if this gives you any difficulty. Okay, good. So for these next motions, just want you to try and relax as best you can. I'm going to be moving your head and your neck into various positions, okay? Okay. Now we're going to go forward. And now we're going to go backwards. Good. Moving your head side to side. Sit and relax. Good. And now I'm going to apply a little bit of traction, so again, just nice and relaxed. Good. And relax. So you're going to feel a little bit of pressure on the back of your neck here. Just try your best to relax. Okay. Now we're going to move on to next technique. Same thing, just staying nice and relaxed. Okay. And one more. Okay,